Well, thanks, AJ, for the great introduction. That's a long title as a presentation. So yeah, I'm a postdoc with the Aisha team. Essentially, this analysis has been a work in progress. Together with Dr. Shira Goldenberg, and a lot of team members have been given a lot of great feedback. So it's a work in progress. The analysis specifically here we're focusing on is really some of the prominent migration related factors and how that impact access to services among women sex workers here in Metro Vancouver. So I'm going to start with a bit background, as we all recognize that access to services is a basic fundamental human right. Same time, sex workers often face a lot of different kinds of inequities, and oftentimes these inequities are highly social and structural. I earlier mentioned about criminalization. Oftentimes they are also intersecting with stigma, insecurity, housing-related insecurities, or different forms of colonial violence against different kinds of sex worker groups and so forth. So when I think about migration, it is certainly a personal process, but at the same time, it is also highly social, structural, and also even political process. Oftentimes, certain migration-related conditions could position certain sex worker communities at a very much less advantaged position when it comes to accessing services. So including precarious migration status, language barriers, and different kinds of racialization related experiences. And these are also the three major factors we're focusing on today. Just to know, in the current empirical literature, these individual factors have been studied to some extent. Here, what we are really interested in to look at also from a sort of intersectional lens, social structure, different determinants of health, to look at how these different individual factors may intersect with one another to impact their service access. So the research overall aims to understand this intersectional association of these three different factors here. Specifically, we're looking at citizenship status, English fluency or limited English fluency, and Asian-racialized identity, and how that is associated with the two major outcomes: access to health services and also access to community-based services for sex workers here in Metro Vancouver. Data that we use for this analysis came from our Aisha, this longitudinal community-based cohort study. The three main factors of interest here we're looking at, again, include the first one having no citizenship, coded as a yes or no binary variable, and the other two also a yes or no binary variable coded, having limited English, and also identified as an Asian-racialized person. Here are our two outcome variables. First, access to health services. So we coded again as a yes or no, but then in the regional survey, it was a 5-point Likert scale question. Respondents were invited to kind of on a 5-point from always to never. So always and usually were coded into yes, the rest coded into no. And for access to sex work community-based services, so we provided a list of the local community-based outreach or sex worker-led services. So participants can check off any of the ones that they've used in the past 6 months. And so when they check yes of any on the list, we coded as yes, otherwise no. So what we did in the main analysis is regression using generalized estimating equations, or GEE, including 3 different interaction terms as I listed here. Also with 2 different outcomes. So in total, we attempted to estimate 6 different models here. So each one of interaction terms, including each one of the models, and with the 2 outcomes. And then we adjusted or accounted for the effect of some prominent confounders based in the existing literature. So just a quick highlight of the sample characteristics, as we could sort of see them for the 3 main factors. About a quarter had no citizenship, and 1 out of 10 reported having were speaking limited English, and about another quarter identified as Asian. For our main outcomes at the baseline, and that's the first time point participants were enrolled in our study, I would say the majority reported having access to health services when they needed, and a little over half had access to sex work, community-based services. And as you can see over time, over the 8-year course, those two numbers slightly increased a bit. Here is just a table documenting at baseline some demographics. It's a quite intense table here. So here are the findings. Here I'm only sharing the main findings because of time. So this is our first outcome, access to health services. As you can see, we mapped out all the odds ratios here. The red line, dotted line in the middle refers to reference groups. So in the first model, we include this interaction term of citizenship status and English fluency. As we can see from the chart here, if we could look at the first two subgroups, they both have no citizenship. As you can see, the odds of access to health services significantly reduced. But then comparing these two together, moving from limited English fluency to fluent English fluency, there's a slightly increase in the odds, but again, they are compared to the reference group, there is a big significant drop in the odds. And again, here's our second model, including the interaction term citizenship and Asian, identified as an Asian-racialized person. So the first subgroup here, those folks identified as having no citizenship and also identified as an Asian had a much reduced odds for accessing health services. And this is the only significant result here in this model. And we were unfortunately unable to perform another GEE with the intersection term citizen, the interaction term Asian racialized identity and English fluency due to the insufficient sample size for that model. But we are successfully performed all three models for the second outcome, which is access to sex work community-based services. So again, we could sort of see this very similar pattern of gradient here. For instance, in our first model, again, if we could look at the third subgroup and the first and the third subgroup, they both experience having limited English fluency, but then moving from having no citizenship to having citizenship, there is I would say pretty big increase in the odds, but still all three subgroups had very much less likely access compared to the reference group. And the second model here, including interaction of citizenship and identified an Asian racialized person, so having no citizenship and identified as an Asian had a pretty much, again, reduced odds. I'd like to kind of draw attention to the second group here, which is folks having no citizenship and also identify as non-Asian. I would say, well, certainly if we look at the odds ratio here, it's probably the lowest, but then also there's this wide range in terms of the confidence interval. And I just want to say that this is, I would say generally refer to a group of migrants, but they're non-Asian, but then it's a highly diverse population. I think even look at this wide range of confidence interval, I think there needs to be a lot more research to be done to really explore more about their very much diverse experiences. So lastly, our third model, interaction of Asian racialized identity and English fluency, again, very similar pattern. The two subgroups identified as Asian racialized person, their odds for accessing community-based services, again, greatly reduced, but then moving from limited English to speaking fluent English, there is that slight increase in the odds there. But still, again, they're all significantly reduced compared to the reference group. So to migration can certainly further the inequity in service access among sex workers. So like to just highlight some implications. I think a lot of us know that even like in Metro Vancouver here, there has been a very limited services linguistically or culturally responsive, whether it's through healthcare settings or community-led spaces, migrant inclusive and sex worker inclusive. And so there's needs to be more advocacy and promotion. And a big part of it, I think, is also about advocating for more systemic funding support for community-led support for sex workers. And everything cannot be fully addressed without understanding sort of the larger structural barriers, including many different kinds of carceral interventions against sex workers, and some of those interventions specifically targeting migrant sex workers as well, such as immigration related consequences for migrant sex workers. At this point in Canada, migrant sex work is still prohibited from in the current immigration policy, and as some of us know, many of the migrant sex workers, Asian migrant sex workers, do sometimes rely on third parties or their managers accessing services, but because of the third party criminalization, even folks do have permanent residency status can still have their kind of path to citizenship jeopardized. And so and finally, there has been this ongoing racialized policing, oftentimes coming from the dominant anti-trafficking operations, specifically targeting, again, Asian migrant sex workers. I think all these structural level carceral interventions should be certainly removed, and then there needs to be ongoing advocacy for that. So this concludes this presentation, and definitely thanks to a lot of our team members who have been doing so much groundwork collecting the data.